We're live on Covered, and we're here with Richard Miltenberger. Richard, welcome to the podcast.
Thank you, Kyle.
Richard is the CEO, president of the co-op, and we're really thrilled to have you here. Where along this path did health insurance become part of your world?
You know, it kind of came in the blood. My dad was in the health insurance business.
Okay.
Before I was born and all when I was raised, so I kind of heard about it around the kitchen table, and as I was coming out of college, I had some other thoughts in mind, but he was actually at the time had prostate cancer. And so he asked because I knew something about his business, if I'd be willing to come and join him at least for a period of time. And that ended up being 40 years now.
40 years later.
Yeah.
Yeah. And so here you are with the co-op. And how long have you been with the co-op?
You know, that's a more complicated question. I mean, I've been an employee of the co-op. I've been president of the co-op for about a year and 3 months.
Okay.
But early on, when it first got started, we had a founding board before the organization had any funds, when we were just kind of a nascent aspirational group of people wanting to start a nonprofit health insurance company in Montana. That was back in 2010. So I was on that founding board for about 4 years.
4 years. The goal, a nonprofit health insurance. Where did that idea come from, and why? Why does the world need a nonprofit health insurance?
You know, we're committed to the idea of nonprofit because we view what's happening in healthcare as really a national disaster. I mean, we talk about national disasters, whether it's a big hurricane or an earthquake. It might cost many billions of dollars. Well, think about healthcare in America. We're spending 18 cents out of every dollar on healthcare. In Europe, they're spending 11 cents, 10 cents of every dollar with very high quality healthcare. Something's gone wrong. We think that a part of that is a combination of kind of a train coming from the east, which is the need for healthcare, and a train coming from the west, which is a profit motive, and those trains have collided. We have a train wreck in healthcare. And we think the profit motive, while it may be good for the economy, and whether you're making cars or publishing books, what have you, in healthcare, it takes it's like you have a compass that has lost its magnetism, and it's just spinning around. People don't know which direction to head, and it takes all the reason for human well-being out of what should be a business that revolves around human well-being.
Right. You mentioned the spinning compass and these trains colliding.
Yes.
We're putting this podcast together for the people that might feel like I am at the intersection, or I'm at the epicenter of this collision, or I'm riding on this compass wheel that is spinning. And so where does a co-op help alleviate or reduce the impact of that crash? And, when we talk to people and say, let's talk about the co-op, they might say, what does it mean to be member owned, and why is that important, and why is that going to change things, or what's the end goal there?
It just changes everything. We are member governed. We have a board of directors made up, it's 17 people, made up almost exclusively of our members, and they're elected by our members. In fact, we have an election going on in September for new board members. We have some great people that have been nominated, and it's a contested election. And what this means is that you don't have a stale board of people that kind of appoint their successors after they get tired of being on the board. So you have this very inward-looking thing. We have a board that is made up of the same people that are writing checks every month for healthcare and for our premium, and they demand excellence. They demand the phone to be answered when they call. You're paying a lot of money for this stuff. You ought to get quality in terms of service, but there's another component that is the pricing and how much the dollars are going to pay for, whether it's executive bonuses or a shiny new office building or whatever it might be. Where is the money going? Is it going for the health care that I'm trying to get, or is it going for overhead? Mm-hmm. And so that's, I'm not sure I answered your question, Kyle, but that's what I would say is the distinctive of our organization, is that we are committed to the people that are paying the premium, not to delivering profits to Wall Street. It
does seem like the motives or the incentives are sort of reversed for a co-op, which it seems like a healthy balance. When we talk about the Green Bay Packers, member owned or fan owned, it feels a little different than a co-op. And when I think about healthcare, and we walked into the door today and I saw affordable healthcare. Can you talk about costs a little bit? And just, you mentioned 12 cents, or was it 18 cents of every dollar
in America is spent on healthcare? Yeah,
spent on healthcare, and why that's happening?
Yeah, and there's some dynamics here. I want to be careful for the listeners. We exist as a health co-op. We exist in a ecosystem that is much, much bigger than ourselves. Mm-hmm. And we're trying to navigate a way for our members to survive and thrive from a health standpoint in that ecosystem. It is not possible like turning on a light where you flip the switch and just change everything. There are some dynamics in our healthcare system that are broken that we're trying to fix. And one example of that be primary care. So if you go to European countries where there's excellent health care and affordable cost, and everybody kind of points to England, and England has a system that the people of England like, but it's very different from Germany, Holland, France, Italy. Mm-hmm. Most of Europe is private health care, whereas in the UK and in England, it is actually government employees providing that care. And so we say, well, it's European, it's socialist. Well, not really. In Holland, they don't have socialized medicine. But what they do have is they have a system where physicians are encouraged to go into primary care. Mm. And so in most of Europe, about 2 out of 3 docs are primary care physicians. They're not invasive care specialists that only make a living if they have a scalpel in their hands.
Right.
So what ends up happening in our country it's kind of like if the only tool you have in your toolbox is a hammer, all of a sudden everything looks like a nail.
Sure.
And so if you end up being immediately referred to an orthopedic surgeon, there's a higher likelihood that you're going to have an orthopedic surgery than if you stay with your primary care physician a little longer. They work with you, you get some physical therapy, make sure that you're properly get the proper medications to reduce inflammation, and try all the alternatives first. So we have one of the highest rates, well, the highest rate in the world in this country of orthopedic surgery. Mm-hmm. Some of that is wonderful, and some of it is just ends up leaving scar tissue that lands you in the same spot you were before. Yep. So again, not to pick on orthopedics or dermatology or any of the specialists. We need them all, and they're all great people. I know a lot of them. But we just, in our country, we depend on the specialty end of the spectrum instead of the primary care. That would change everything to just move the dynamic. And that's something we're working hard to do is get people into the primary care offices.
So for folks that are listening and saying, that sounds great, this is a model that I can get behind, and for some of them, they might be underinsured or uninsured. Before they enroll or sign up during the open enrollment, what advice would you have for them as they're looking at health insurance options? Because there are some choices when you go to enroll, and I think the co-op has done a great job of removing themselves from that Excel spreadsheet that is, well, let's look at costs and let's look at the gold plan and the silver plan, but there's more to it as you've described. But what advice would you have for someone at step one where they're underinsured or uninsured and they're saying this might be a viable option?
Kyle, I would say that first off, to kind of hit one issue square in the head, pretty much everybody in our country at this point is underinsured. And what I mean is the deductibles are too high, the out-of-pockets are too high. We have people that are hardworking Americans making $20 an hour who end up overnight in the hospital, and their out-of-pocket is $5,000, $6,000, $7,000. And oh, by the way, if they're chronically ill, they owe physicians and hospitals for services they received last year. And now they've got a whole new deductible to meet. Yeah. And so a lot of our friends and neighbors are people that are in debt to the medical system, even though they're insured.
Even though they have a plan.
Even though they have a plan. Yeah. So a lot of underinsured people, even those that are insured. But what I would suggest is that you really look at your needs and what your needs might be, even if you're not currently using the medical system. If you're eligible for, I don't want to get too wonky or too in the weeds here, but there's a gold plan, a silver plan, and a bronze plan that are available under the Affordable Care Act. That's how most people that are individuals are getting their coverage. And when you go to look at those, the silver plan depending on your household income, actually it's like a chameleon that changes colors as it goes across the carpet. So a silver plan is not a silver plan is not a silver plan. It says silver, but it's really a nomenclature, a naming issue, I think, for people, because they say, well, it's silver, isn't it? Well, it depends. If your income is 200% of the poverty level, which is frankly where a lot of folks in Montana and Idaho are, if it's 200% of the poverty level, that silver plan has a much lower out-of-pocket expense, lower deductibles, etc. And you may be eligible for that, and it might cost a little more, but if you're looking at the total out-of-pocket for your household, if you're spending a little more on the insurance, but you've got a much lower out-of-pocket when you go to the hospital, it may well pay for itself. So I'd encourage people not to just quickly say, well, bronze is the least expensive, I'll buy that. Instead, to step back and say, hey, maybe I need to see what the silver plan has to offer. So again, a little bit in the weeds there, but I'd say that's the primary mistake that most buyers make.
No, I think that's really helpful, because there are no two exact people aren't coming to these plans in the exact same situation. Everybody's life is changing, and your healthcare needs are, of course, different. Can you share with us a story of a member in your short time here in the last year or so that just made an impact on you, and somebody that maybe you talked to or heard about that, this mission, this thing that we set out to do in 2010, was it, that you set out and said, this is the spin wheel is flying. We're figuring things out.
Somebody does come to mind. We have board meetings every 3 months, and every year we have a board meeting that is open to our members to come. And so we have members that do come, and they should come. I encourage them to. So we had a lady who came, and her son has a severe and kind of rare allergy condition, so he has to go to an allergist. And they had ended up in a situation where their physician had left, and they were having to start a new type of treatment. And it was possible by going outside of our network to access a continuation of the old treatment, so that her 16-year-old son will not have to kind of start over at zero, because these are having to go into a doctor's office every week and get a shot, and it kind of builds the immunity up, and so it'd be like starting over. And so she came and explained her situation, and it's one of those deals where if you read the policy, if you read the contract, it's kind of like, we were right, the insurance company was right, she was wrong. But being able to hear her story and understand what the circumstances were, not only would it be better for her son, but it would actually save the plan. It would save us money. It just was like, sometimes by following the rules, you end up in these strange places. So that was a situation where someone was able to speak to us. We heard it. We had our medical director look into it. It all made sense. And so we're trying to take that listening mechanism, so you don't have to come to a meeting in Helena, Montana, but instead, we can hear you through the available channels of calling and having the calls elevated, and making sure that we catch these problems in midair, and not have it caught by somebody that's, because obviously we are an insurance company, so you have a lot of employees who are trained to follow the rules. And yet sometimes the rules they don't make sense in a given circumstance. I'm not sure if that's a good example.
No, that's a very powerful story, because it does show the humanized factor of the co-op, that there are rules and regulations that some of the larger firms out there, they might not understand. They might not ever get a chance to hear from that person, because there is no board meeting that they can show up to and sit with everybody that's making the decisions. And that's really powerful. So Richard, we're going to pivot now into 4 questions that we're going to be asking every guest. And so question 1, can you describe an experience that you had in your career dealing with health insurance, or choosing a plan, or maybe your first job that you had your own independent or your own health insurance, and just what was that experience like?
Back in my 20s, my wife and I, we took a job in Chicago, and this was the heady days of managed care and HMOs in the late 80s. So I was working for an employer, and they had 6 different options that we could choose from. And by the way, I love that alternative. So most employers in rural America today, they pick one insurance company. It might be the health co-op. It might be a Blue Cross. It might be any number of companies. What a great idea to instead let your employees choose and offer all of them. But that used to actually be common for large companies in larger cities. And I think it's something that we need to have a comeback. So if you're an individual buying coverage, you get to pick. But if you're an employee, your employer gets to pick. I don't think that's a very smart idea. Anyhow, so I got to pick, and I had to choose between a physician group that was not very close by our home, but the copays were lower, et cetera, and choose between one that had more doctors available, but was a little more affordable, a little less out of my paycheck, but much higher deductibles. And so it was nice. My wife and I sat down, and we were actually thinking about another child who has since, of course, now graduated college. This was a few years ago.
Sure.
And so we chose the plan that had the lower copays. We paid a few more pennies out of my paycheck, and we had to drive, extra mile to the doctor, but we were very pleased with that plan.
Yeah. You probably felt empowered too. Like, hey, we got to make this decision and go with that.
Yeah.
So we talk about Montana Health.
Yes.
What does mountain health lifestyle mean to you?
For me, we like to think of our plan as one that has kind of come out of the soil almost, and that we had local people here in Montana. We formed Montana Health Co-op for the people here because we're all people that wanted a different and better and nonprofit alternative. We had some people in Idaho approach us, and we ended up in a process where we expanded to Idaho. Using the name Montana Health in Idaho doesn't make a lot of sense, so we're now Mountain Health Co-op to those folks, and we'll use that name interchangeably. But to me, the lifestyle, Kyle, I guess, would represent what people expect to find in our part of the country, which is a cooperative existence where we're depending upon one another. If you live in a rural community, you can't be as isolated as you might in Los Angeles or New York or even a community like Dallas, Texas, with a couple of million people. You can isolate yourself. But if you're in a rural community, you become interdependent. We think of rugged individualism, but really there's a lot of interdependence in this part of the country.
Yeah.
There's electric co-ops. There's electric phone company. There are phone companies that are co-ops in these rural communities.
Yeah.
But we also have in some of the larger communities food co-ops, and just the idea of saying, hey, we're going to be in this together. We're not going to allow our resources to simply. We're not going to be used as a place for people in New York to make profits, but instead we're going to look to ourselves to solve these problems. So I think that's part of what it's about. It's kind of like saying, hey, we're going to keep our resources here, and we're going to keep our people here. We're going to be interdependent on each other and not dependent on somebody from 6 states away telling us what healthcare ought to look like.
Right. Yeah, that's powerful. What would you say is a hobby you participate in that puts you at the most risk of needing to use your health insurance?
Skiing.
Skiing.
Yeah, I do some cross-country skiing, but that's not very risky. But the downhill skiing, I didn't learn to ski till I was 40 years old.
Oh, wow.
And so I'm not very good, but I don't always recognize that. And so it just is so exciting to get a little speed up, and then all of a sudden I think, oh my gosh, oh crap, where am I going to go with this?
Well, cross-country skiing can sometimes turn into downhill skiing unintentionally.
Yeah, unintentionally.
And that can be probably more dangerous than regular down.
Yeah,
when your heel is released,
yes,
that gets risky. And finally, other than the co-op, what are some other ways that you see being important to just make an impact on your community in a positive way?
As an organization here, we have attempted to get involved with what I'm going to call true nonprofits. Now, we're a nonprofit, but we're kind of an institutional nonprofit. You wouldn't write a check as a charity and say, hey, I want to donate this.
Sure.
So that you'd write us a premium check and buy your insurance from us.
Yeah, join the co-op.
Right. It's a different kind of nonprofit. We think it's important that we support the what I would call charitable nonprofits here in the state. One of the ones that we take a lot of interest in, and we've been a long-term contributor, is the YWCA.
Great.
and they provide a wonderful resource. The stories that you hear coming out of there, it's just a place where people, women, can seek refuge when they're in abusive situations, or perhaps they find themselves might not be a guy that's pushed them out. Might be a mom who said, "Look, I need you out of here," and so they find themselves needing a place to stay. And it's just a cool place where you not only get resources like shelter and food, but also counseling and some job skills. And so we're very proud to partner with those folks.
Yeah, that's great. That's impacting the community in an extremely positive way. So
yeah.
Well, thanks for your work here at the Co-op, and thank you for being guest number 1 on our cover podcast.
Thank you. Yeah.
We really appreciate it. And I think this episode will provide tremendous value to people who are just getting started in their sort of health insurance search, or wondering, well, what is the health co-op all about? So thanks again.
Kyle, thank you.